Let's quickly start. Are you these or are you these? Now, if you are either of these two, then I have a very good way for you to understand what goes on in the discussion. And I have a summary protocol called the PReSSuRE protocol. The first thing in the PReSSuRE protocol is to prepare. You need to prepare for the conversation, and which is either way. So I would talk about for the healthcare professional first, and then I'll do a patient video next. So in preparing, you need to think about everything related to the circumstances around the patient care up to that point. The next thing is you need to consider what we call the relationship framework for communication. You need to think about whether it's going to be a tense conversation, it's going to be a difficult one, it's going to be one where you would need de-escalation. After you've done that, you would need to consider what I call the self-discharge discussion in detail. Here you talk about the implications of self-discharge, how it would interrupt the continuum of care, and all of that, and the fact that the impact it will have on the patient's continuum of care, and also the chances that he may allow development of complications outside of hospital. The next is the big elephant in the room. This is where it's called the sureness of patient's capacity. And what you try to do is you need to be sure that the patient has the capacity to take that decision as a competent adult in the climate you're practicing. And usually there's a test to determine this. In the UK and most parts of the world, you can use the abbreviated mini mental state exam. After that, you do a summary, and then you try to end the meeting. So this is the PReSSuRE protocol for discharge against medical advice. And this is the healthcare professional version. So whether you are a doctor, a nurse, a nursing student, or a medical student, or any other health professional student, you would find this useful.